It's very important to identify the signs and symptoms of stroke immediately because it makes a difference with what types of treatment options are open to the patient. Symptoms and signs of stroke can include a facial droop where half of the face is droopy compared to the other half, an inability to talk clearly with slurred speech, difficulty with holding food in the mouth or liquids, numbness or tingling in the arms or legs, inability to walk, falling due to an inability to walk with weakness of one limb compared to the other. When the patient arrives at the emergency department, the first rule and the most important rule of treatment is when the last well-known exam or time was. So for example, if a patient goes to bed normally, but awakens with these new symptoms, we cannot simply assume that the time of onset of the symptoms was when they first awakened, because the symptoms could have occurred at any time during the entire time they were asleep. With that time set, the physician in the ER, the emergency department physician, will be able to determine which type of treatment options are open. Now, 4.5 hours is our cutoff, and then 24 hours is the second cutoff. So if the patient presents in under 4.5 hours, then they are going to get a CT without contrast of their brain. And that's to look for signs such as hemorrhage. If they continue to have the symptoms of stroke, there are signs evident on the physical exam as performed by the emergency department physician, and the drug therapy is eligible, the IVT, what we call intravenous thrombolytic therapy, is available, and the patient lacks any contraindications or reasons to not receive the drug, they will get the drug, and then they'll be admitted to the hospital for 24 hours of monitoring. If, however, the patient arrives after 4.5 hours, but they arrive before the 24-hour marker, then they may still be eligible and a few tests have to be done, such as a CT without contrast of the brain. An MRI may also be performed if available on an emergent basis. And if the MRI shows findings that are suggestive of changes with viable brain tissue and the patient can receive IVT or intravenous thrombolytic therapy because there are no reasons to not receive it, and then finally the drug is available emergently, then the patient may be able to receive that drug blood thinner. Now, it's very important to note that the management of stroke doesn't stop there. There is another test that needs to be done. It's also a CT, but it's a CTA of the head and the neck arteries. The idea is to evaluate for blockages in the large vessels of the head and neck, because that can actually make a difference as well. So let's say after the IVT or the blood thinner is administered, they order this test and a large vessel blockage is seen, a blockage whether it be in the cranial vessels or in the neck vessels. Then there needs to be emergent intervention. And this is important because this can help save brain tissue. So within the 4.5 to 24-hour window, if such vessel occlusions, is what we call them, are visualized, then a transfer has to be performed to a stroke center that has a neurosurgeon or a neurologist that has the capabilities to perform an intervention. Usually what they'll do is they'll go in and they'll open up the vessel with either a stent or some other thrombolytic process. Now, most hospitals don't have these specialized physicians. Each state has a system where if smaller satellite hospitals lack the ability to perform this treatment, they are able to provide consultation. So the metropolitan areas that usually have these neurosurgeons and capable trained physicians that can perform these procedures will often have some form of agreement where you can call them, and if they have the capacity or a bed availability for your patient, they will take them as immediately as possible. Sometimes the patients are transferred by flight. That has happened. They have to go through a whole series of questions to ensure that they're candidates to receive that blood thinner, or what we call IVT. They are monitored in a neuro step-down unit or in the ICU, which is different from a regular medical surgical unit. Once 24 hours are up, they will receive another CT or some form of imaging of their brain to ensure that no bleeding has occurred. The IVT medications, a couple examples are Alteplase and Tenecteplase, are highly potent blood thinners, and around 6% of the patients who receive these blood thinners received complications such as fatal intracranial hemorrhage, which means they developed a head bleed which led to their death. So it's very important that the patients are screened appropriately, but that they also receive the IVT as quickly as possible. Other studies that are necessary to evaluate for stroke include an echocardiogram, which is an ultrasound of the heart. The idea is to evaluate for any defects in the heart that could allow the passage of clots that may increase your risk. Heart monitoring is also performed in the hospital, and the heart monitoring allows us as physicians to detect abnormal heart rhythms. Sometimes an abnormal heart rhythm cannot be detected while the patient is in the hospital. If there's no other reason that can explain the stroke, such as a cryptogenic stroke, then the patient may have to be set up with an outpatient heart monitor later on. Their lipids or cholesterol levels will be checked. Their hemoglobin A1C, which is a marker for diabetes, will also be checked. If they're smoking, they'll be counseled against further use. Outside of that, you'll have physical and occupational speech therapy that will come to evaluate the patient. Now, ultimately, the best treatment for a stroke after the IVT is therapy. And the manner and the type of therapy that is offered depends on the disability that the patient sustains. So if the patient walks out without any disability and their stroke symptoms resolve, they're the lucky few that don't really have to do anything more other than take the medications that are prescribed. But there are many causes that can contribute to stroke, and outside of the disability treatment with therapy, they'll have to take medications daily for the rest of their life. And so that's, in a nutshell, the overall management of a stroke is very important to identify these patients early, just because these sensitive, time-sensitive procedures are limited. And on top of that, there's other limitations when it comes to the IVT or intravenous thrombolytic therapy. If you have any questions, please post below. And until next time.